Knowing the warning signs and symptoms of stroke can increase your chances of survival. According to the Centers for Disease Control, stroke kills almost 130,000 Americans each year. That's 1 out of every 19 deaths. But patients who arrive at the emergency room within 3 hours of their first symptoms tend to have less disability 3 months after a stroke than those who receive delayed care. FAST is an easy way to remember the sudden signs of stroke.
FAST is an acronym that is utilized for patients to a quick memory method for them to recognize the signs and symptoms of stroke. And what FAST stands for is facial drooping, arms, speech, and time. Facial drooping, what you see with a lot of strokes is one side of the face, either the right or the left, sagging a bit. Also, on that same side, you'll have arm movement, that one-sided paralysis. Their speech will be slurred, which is the S in that FAST acronym. And finally, T is time. Time is of the utmost importance in a stroke situation. We want to get them to the hospital within that 4.5 window so that a medication called TPA can be administered and hopefully reverse the effects of that stroke.
A stroke is caused by interruption of blood flow to the cells in the brain that transmit information and allow you to function normally. When this happens, the brain cells begin to die almost immediately from a lack of oxygen and nutrients.
A lot of folks think there are just one type of stroke, that it's all a broad-based category and all strokes are the same. But actually there are 2 varieties of stroke. And the first category is ischemic strokes. Those comprise the vast majority of strokes that you hear about. But there is also a second category, and those are referred to as cerebral hemorrhages. They comprise a much smaller total volume of strokes, but they are also a totally separate type, and we do see those from time to time as well.
When you spot the signs of a stroke, you should immediately call 911.
It's important to give the ambulance district a call and allow our paramedics to come out and assess the situation, because you're not always sure exactly when those signs and symptoms started. It might have been 5 minutes ago, in which case you might have the opportunity to get them in the car, get them to the hospital within that 4.5 hour window. But if it happened some time ago, the situation may be a little different, and time really may be a very, very critical factor in that situation. In addition, the medics are going to be very well trained in how to diagnose and see what's going on in that situation, and could perhaps get you to a different facility if needed. All of the hospitals out here in our community are capable of treating stroke.
There are thousands of great resources out there that can help you get better educated on the signs and symptoms of stroke.
A couple great resources are the American Heart Association, the American Stroke Association, as well as here locally, our healthcare systems, BJC, SSM, Mercy. They have got some phenomenal resources available for patients who have suffered strokes in the past, as well as those who are just concerned about learning a little bit more and learning more about those warning signs and symptoms.
If you suspect someone around you is having a stroke, always remember to use the FAST test, because catching a stroke early can be the difference between life or death.